Question 1. When a provider prescribes an for infusion medication to be titrated, which of the following elements is not required to be part of the order? C. Ability of the nurse to determine the units of incremental rate. According to the Joint Commission, required elements for medication titration orders include the following: 1. Medication name. 2. Medication route. 3. Initial or starting rate of infusion, dose minute. 4. Incremental units. The rate can be increased or decreased. 5. Frequency for incremental doses. How often the dose, rate, can be increased or decreased. 6. Maximum rate, dose, of infusion. 7. Objective clinical endpoint or patient response. The nurse follows the titration prescription and does not make independent determinations regarding the infusion. Question 2. A patient with a history of atrial fibrillation is scheduled for a left hip hemiarthroplasty at 9 o'clock. A health professional is administering medications at 8 o'clock. Which of these medication orders should the health professional question? B. Low molecular weight heparin anticoagulant subcutaneously. Heparin and low molecular weight heparins are normally held 12 hours before surgery because of the increased risk of perioperative bleeding. Patients with a history of atrial fibrillation are often on anticoagulation therapy to prevent the formation of blood clots. The health professional should contact the appropriate physician to clarify whether the heparin should be administered. Question 3. During an acute exacerbation of inflammatory bowel disease, a patient is to receive total parenteral nutrition, TPN, and lipids. Which of these interventions is the priority when caring for this patient? C. Monitor the patient's blood glucose per protocol. Total parenteral nutrition, TPN, can cause hyperglycemia, so blood glucose levels should be closely monitored. Because of the hypertonicity of the TPN solution, it must be administered via a central venous catheter. The high concentrations of glucose and lipids make TPN an excellent medium for bacterial growth. Therefore, administration sets should be changed every 24 hours if the TPN contains lipids. Question 4. The purpose of holding a sterile gauze pad on the site of an IM injection while removing the needle is to B. Decrease the discomfort of the needle pulling on the skin. Pressing the gauze pad against the skin while removing the needle reduces the discomfort of the pulling sensation. Once the medication has been completely injected, remove the needle using a smooth, steady motion. Remove the needle at the same angle at which it was inserted. Question 5. The purpose of medication reconciliation is to A. Create an accurate list of all medications that a client is taking at home and during hospitalization. Medication reconciliation is the process of creating the most accurate list possible of all medications that a patient is taking, including drug name, dosage, frequency, and route, and comparing that list against the physician's admission, transfer, or discharge orders. The goal is to provide correct medications to the patient at all transition points within the hospital. Question 6. The healthcare provider would anticipate which of the following as a treatment option for pneumonitis. B. Corticosteroid administration. Corticosteroids are often recommended to treat inflammatory conditions such as pneumonitis. The other options are not appropriate. Chest tubes are used for drainage. Albuterol is a drug for rapid bronchodilation. A thoracotomy is a surgical procedure in which a cut is made between the ribs to see and reach the lungs or other organs in the chest or thorax. Question 7. The nurse is preparing to administer procedural morphine sulfate as an analgesic to a 4-year-old child who weighs 40 pounds. The healthcare provider, HCP, has prescribed 4 mg morphine sulfate for. What is the nurse's best action? C. Verify the dosage for the child. The nurse should verify the dosage strength, right dose, for the child before administering. For this child, 40 pounds equals 18.2 kilograms, the dosage should be 1.5 to 1.8 milligram dose. For procedural analgesia and sedation in children, morphine sulfate is given 0.08 to 0.1 milligram kilogram dose for IM or SC before the procedure and every 5 to 10 minutes as needed. Peak effect is 15 to 30 minutes after for administration and 30 to 60 minutes after IM administration. Morphine sulfate is indicated for procedural analgesia because it is reliable, predictable, and easily reversed with naloxone. Note, an average 4-year-old weighs 40 pounds and is 40 inches tall. Question 8. Which of the following drugs should not be refrigerated? C. Nadolol, Corguard. Nadolol, Corguard, is a beta blocker used to treat hypertension and chest pain. It is stored tightly closed at room temperature from 59 degrees Fahrenheit to 86 degrees Fahrenheit, 15 degrees Celsius to 30 degrees Celsius, away from heat, moisture, and light. Humulin N is a form of insulin. After it has been opened, it is stored in the refrigerator or at room temperature below 86 degrees Fahrenheit. Humulin N must be discarded within 31 days after opening. Ampicillin is a penicillin antibiotic. The liquid suspension form should be stored in the refrigerator for up to 7 days. Epoetin alpha 4 is used with patients undergoing chemotherapy or suffering from anemia from serious chronic diseases. It is stored in the refrigerator and should be protected from light. Question 9. While a healthcare provider is caring for a patient following a laryngectomy, the patient suddenly becomes pale and non-responsive with a BP of 90/40. What should be done first? C. Increase the infusion of dextrose in normal saline, D5NS. D5NS infusion is hypertonic, so it will draw fluid into the circulation. Trendelenburg position could compromise the airway in a patient who has had head or neck surgery. Atropine could cause hyponatremia and further hypertension. It is not necessary to move the emergency cart to the patient's bedside at this time. Question 10. A patient who has a history of chronic back pain requires a higher dose of an opioid medication to achieve adequate pain relief. The healthcare provider suspects that these findings are a result of which of the following? A. Tolerance. Tolerance is a decrease in sensitivity to a medication. It is a common occurrence when opioids are taken for an extended period of time, and leads to the patient requiring a progressively larger dose to achieve the same degree of pain management. When a patient seeks assistance to manage their pain, the patient's behavior is sometimes referred to as pseudo-addiction. Addiction is characterized by behaviors that include impaired control over substance use, cravings, compulsive use, and continued use despite harm. Question 11. A provider has prescribed isotretinoin, Accutane, for a 22-year-old female with a diagnosis of severe cystic acne. Before the nurse gives the client instructions for taking the medication, which of the following is the most important question that the nurse should ask the client? B. What date was your last menstrual period? A teratogen is an agent that can disturb the development of the embryo or fetus. Taking isotretinoin, Accutane, during pregnancy can cause birth defects of the brain and heart as well as facial deformities. Before providing the client any instructions on taking this medication, the nurse should determine whether the client might be pregnant. The client should have a reliable birth control method. The capsules are swallowed whole with a full glass of water. Unusual weight gain or weight loss are listed as rare or unknown adverse reactions. Question 12. A healthcare provider, HCP, prescribes an intravenous medication to be administered 25 micrograms per kilogram per minute. The client weighs 52 kilograms. How many milligram, will the client receive in 1 hour? C. 78 milligrams. 1 microgram equals 0.001 milligrams. To convert 25 micrograms, set up a proportion. 0.001 equals 25x, cross multiply. 0.001 times 25 is equal to 0.025 milligrams, and then multiply by 52 kilograms equals 1.3 milligrams per minute. In 1 hour, 60 minutes times 1.3 milligrams, the client should receive 78 milligrams. Question 13. A clinician is teaching inhaled corticosteroid technique. Which of the following should be included in teaching? C. Press the canister down, breathe in slowly and deeply, hold your breath for a few seconds, and then slowly exhale. Breathing in slowly and deeply and then holding one's breath allows for the medication to move farther down the patient's airway. If possible, the patient should count to 10 before exhaling. Spacers are typically suggested because they prevent the medication from collecting on the tongue and the back of the throat. Because inhalers leave a residue in the mouth, they can increase the risk of developing candida infections. The patient should always rinse their mouth after use. Question 14. Before administering a dose of furosemide, Lasix, to a 2-year-old with a congenital heart defect, the nurse should confirm the child's identity by checking the hospital ID band and C. Asking the parent for the child's name. Standards of safe medication administration require obtaining 2 patient identifiers before proceeding. For a child, a parent can give the child's name. Many young children do not know their full name or are accustomed to being called by a nickname. Adults can be asked the child's name and birth date. Room numbers are not a reliable means of verifying identification. Question 15. A client with deep vein thrombosis, DVT, is receiving heparin therapy by continuous intravenous infusion. Prior to initiating the heparin infusion, the client's activated partial thromboplastin time, APTT, was 32 seconds. The nurse notes that the most recent APTT result is 70 seconds. What is the nurse's best action? A. Maintain the heparin infusion rate. The nurse should maintain the current heparin infusion rate. The reference range of APTT is 30 to 40 seconds. To obtain an APTT result, an activator is added that speeds up the clotting time and results in a narrower reference range. The APTT is considered a more sensitive version of the PTT and is used to monitor the patient's response to heparin therapy. Decreasing or increasing the infusion rate is not appropriate. Protamine sulfate is a heparin antagonist, used to immediately reverse the action of heparin. It is not indicated for this situation. Question 16. Following a client's intentional benzodiazepine overdose, the emergency department physician prescribes flumazenol 200 micrograms for push stat. The stock vial contains 0.5 mg flumazenol in 5 ml solution. How many ml should the nurse draw up and administer? Provide an answer to 1 decimal place. B. 2.0 milliliters. The nurse will draw up and administer 2.0 milliliters. To calculate, 1. Convert milligram to mcg, 0.5 milligrams x 1000 is equal to 500 mcg. 2. Known, 5 milliliters equals 500 micrograms. 3. 1 milliliter equals 100 micrograms. 4. 2 milliliters equals 200 micrograms. 5. You can also set up an equation, 5 milliliters x 200 micrograms divided by 500 micrograms equals 2.0 milliliters. Flumazenol, a specific benzodiazepine antagonist, is used as an antidote for intentional benzodiazepine overdose, as well as reversing the sedation and respiratory depression from anesthesia. Question 17. A patient diagnosed with type 2 diabetes mellitus is admitted to the medical unit with pneumonia. The patient's oral antidiabetic medication has been discontinued, and the patient is now receiving insulin for glucose control. Which of the following statements best explains this change in medication? C. Stress-related states such as infections increase the risk of hyperglycemia. Infections cause a stress response in the body by increasing the amounts of such hormones as glucocorticoids and epinephrine, which suppress the natural immune response. These stress hormones work against insulin and cause an increase in blood glucose levels. With high glucose levels, white cells are slowed and take longer to fight the infection. Type 2 diabetics may temporarily require insulin during acute illnesses and hospitalizations, but they often return to their normal medication regimen after they recover. Insulin injections also permit more accurate control of glucose levels than oral medications. Question 18. A patient is admitted to the medical unit with a diagnosis of hepatitis. When preparing to administer intravenous medications, the healthcare provider understands that the patient's diagnosis primarily affects which phase of pharmacokinetics. A. Metabolism. The liver is the primary site of drug metabolism, so alterations in liver function can affect the metabolism of medications. Liver disease can make drug metabolism unpredictable, with serious consequences. Liver function can also affect excretion to a lesser degree, if the liver's ability to make medications water-soluble is compromised. Question 19. A patient presents to the emergency department with a complaint of watery diarrhea for the past 3 days. Assessment findings include blood pressure 160, pulse 98, and dry mucous membranes. The healthcare provider would anticipate intravenous therapy administration with which of the following fluids? A. Isotonic crystalloid. Hypovolemia is corrected by expanding the intravascular compartment. An isotonic full solution will expand the intravascular compartment without affecting cells and tissues of other fluid compartments. Hypertonic and colloid solutions would pull fluid into the intravascular space but at the expense of other fluid compartments. Question 20. A healthcare provider is caring for a patient receiving intravenous chemotherapy for cancer. The healthcare provider will plan to administer the prescribed antiemetic to the patient. A. Before starting the infusion. Most chemotherapeutic agents have a high potential for causing nausea and vomiting. Up to 80% of patients experience chemotherapy-induced nausea and vomiting, which occur when the vomiting center in the brain is stimulated during the chemotherapy infusion. Administering an antiemetic prior to starting the infusion can prevent or minimize nausea and vomiting. Question 21. The physician orders an 4-theophylline drip at 40 mg per hour. The pharmacy sends a 250 ml bag of D5W mixed with 500 mg theophylline. What should the infusion rate on the pump be? C. 20 ml per hour. To calculate the infusion rate, 1. Divide the dose that was ordered by the available dose. 40 mg divided by 500 mg equals 0.08. 2. Multiply that value by the quantity, 250 ml, to be infused. Answer: 20 ml per hour. Question 22. The nurse is preparing to administer intravenous procainamide to a client with stable ventricular tachycardia. Which of the following is most important to monitor during the infusion? A. Continuous ECG. Procainamide is well tolerated and is a first-line agent for the treatment of acute, undiagnosed, wide complex tachycardia. Procainamide and NBSB, blocks and NBSB, sodium channels and NBSB, and also has an effect on potassium and NBSB, channels and NBSB, and so prolongs the effective refractory period, decreases automaticity and slows conduction. The client's ECG should be constantly monitored for cardiotoxicity, widening of QRS, and GT, 50%, and prolonged QT interval, as well as hypertension. Question 23. Following an allergic reaction during a blood transfusion, the healthcare provider, HCP, prescribes diphenhydramine injection 30 mg IM stat. The vial containing the medication has 50 mg per milliliter. How much solution will the nurse draw into the syringe for administration? A. 0.6 milliliters. The nurse should draw up and administer 0.6 milliliters of solution, using the desired dose over available Formula 1. Desired dose, 30 milligrams, divided by available dose, 1 milliliter, equals 50 g divided by xml. 2. xml equals 30 milligrams divided by 50 milligrams equals 0.6 milliliters. Diphenhydramine hydrochloride injection solution is an antihistamine that treats allergic reactions to blood or plasma transfusions and NBSB. The injectable form has a rapid onset of action, within 20 to 30 minutes. Question 24. A patient is prescribed a thiazide diuretic for the treatment of hypertension. When teaching the patient about the medication, which of the following will the healthcare provider include? C. Be sure to include a number of foods in your diet that are rich in potassium. Because thiazide diuretics produce an increase in urine output, the patient should avoid taking the medication in the evening so that sleep is not interrupted. Potassium is lost in the urine along with sodium and chloride, so the patient should be instructed to include potassium-rich foods in the diet to avoid hypokalemia. Examples of potassium-rich foods include avocados, spinach, sweet potatoes, yogurt, and bananas. Question 25. The healthcare provider prepares to administer a corticosteroid to a patient with a diagnosis of asthma. What is the rationale for administering this drug to this patient? A. To decrease airway swelling. Corticosteroids and other anti-inflammatory drugs work by reducing inflammation, swelling, and mucus production in the airways of a person with asthma. As a result, the airways are less inflamed and less likely to react to asthma triggers. Inhaled corticosteroids are the primary treatment for asthma. Question 26. A healthcare provider, HCP, prescribes metronidazole PO/BID/X 7 days for a client with a diagnosis of bacterial vaginosis, BV. When the nurse reviews information about the medication with the client, which statement by the client indicates a need for further instruction? A. If I miss a dose, I will take 2 to catch up. Metronidazole is a broad-spectrum antibiotic that is used to treat a variety of infections, including bacterial vaginosis. If a dose is missed, the client should not take a double dose. The client should take the medication at prescribed intervals with a meal or a full glass of water or milk. The client should avoid alcohol while taking metronidazole and for 72 hours after finishing all doses. Drinking can cause nausea, abdominal cramps, vomiting, and headaches. Loss of appetite and a metallic taste in the mouth are possible side effects that go away when the medication is finished. Question 27. A patient with a diagnosis of hepatic coma is admitted to the ICU. The provider orders neomycin 300 mg Q6H to be administered via the NG tube. The nurse knows the rationale for this drug order is: C. To decrease the serum ammonia level. Although neomycin is generally prescribed to treat infection, it is also prescribed for patients with liver disease to kill intestinal bacteria. The bacteria produce ammonia when breaking down protein. The diseased liver is unable to clear the ammonia, so serum levels build and lead to hepatic encephalopathy. Neomycin does not affect pH or prevent further liver damage. Question 28. When a drug's effect is increased after a second drug is administered, this interaction is called B. Potentiation. Potentiation is a type of drug interaction. Potentiation occurs when two drugs are taken together and the action of one drug increases the action of the other, causing the pharmacologic response to be greater for one of the drugs. Question 29. Before administering 2 units of whole blood, what type of intravenous 4 device should a healthcare provider use? A. A large bore catheter to allow blood cells to pass easily into the patient. Large bore catheters are necessary to prevent damage to blood cells. This also decreases development of clots from hemolysis. An 18-gauge needle is often the standard for blood administration. Question 30. The healthcare provider, HCP, prescribes aluminum hydroxide suspension TID between meals and at bedtime for a client with severe heartburn. When the client returns for a follow-up appointment, which side effect is most important for the nurse to ask about? C. Constipation. Aluminum hydroxide is an antacid that quickly neutralizes gastric acid. It is used to treat heartburn, acid indigestion, and upset stomach. It can also reduce phosphate levels in certain kidney conditions. Constipation is the main side effect, which can lead to worsening hemorrhoids or bowel obstruction. Other side effects include loss of appetite, pain on urination, drowsiness, and muscle weakness. The other options are not related to the use of aluminum hydroxide. Question 31. A client with a diagnosis of depression is prescribed phenolzine sulfate, NADIL. When he returns to the clinic a week later, he reports that he doesn't feel any better. The nurse explains that when starting a monoamine oxidase inhibitor, MAOI, the client won't experience relief of symptoms for how long? A. 3 to 4 weeks. A client should be taught that MAOI inhibitors, such as NADIL, require about a month to achieve therapeutic blood levels and demonstrate relief of symptoms. Clients should also be instructed never to discontinue an MAOI drug abruptly without first consulting with their provider. Question 32. All of the following are equivalent to 25% except C. 25. A percentage is a number that is expressed as a fraction of 100, or parts per 100. Percentages are used in medicine in several ways, including for solutions, such as sodium chloride 0.9%, injectable medications, such as lidocaine hydrochloride 2%, and calculations of an infant's weight loss or gain. Question 33. While monitoring a client receiving fresh frozen plasma, FFP, the nurse notes that the client suddenly complains of shortness of breath. Vital signs indicate elevated heart rate and blood pressure. The nurse auscultates crackles at the base of the client's lungs. What complication is the client most likely experiencing? B. Circulatory overload. Circulatory overload occurs when blood or plasma enters the bloodstream too quickly. It is evidenced by respiratory distress, tachycardia, hypertension, and the presence of pulmonary edema, crackles. The client may also display neck vein distension. Pulmonary embolism signs also include respiratory distress, tachycardia, and hypertension, as well as hemoptysis, fever, chest pain, diaphoresis, and fainting. The most common signs of a transfusion reaction are chills, back pain, fever, itching, hives, and shortness of breath. Signs of a myocardial infarction include pressure or tightness in the chest, pain in the chest, jaw, and upper body, shortness of breath, diaphoresis, nausea, vomiting, and anxiety. Question 34. A patient is prescribed a calcium channel blocker to treat primary hypertension. When teaching the patient about the medication, which of these foods will the healthcare provider advise the patient to avoid? D. Grapefruit. Grapefruit and its juice contain furantomerins, which inhibit the cytochrome P450 enzyme CYP3A4. CYP3A4 is involved in metabolizing many drugs, including calcium channel blockers. Medication blood levels can increase, becoming toxic. The levels of calcium channel blockers are increased when grapefruit or grapefruit juice is consumed, potentially causing hypertension. Grapefruit can interfere with other drugs too, including statins, atorvastatin, lovastatin, simvastatin, some antibiotics, and some cancer drugs. Question 35. A client asks the nurse why their healthcare provider, HCP, has prescribed phenazopyridine for their urinary tract infection. What is the nurse's best response? D. It relieves the pain and itching caused by the infection. Phenazopyridine does not treat the cause of the urinary irritation, but it can help relieve the symptoms while other treatments take effect. Phenazopyridine is a dye that works as an analgesic to soothe the lining of the urinary tract. It relieves the itching and burning, as well as urinary urgency and frequency. It is both a prescription and an over-the-counter, OTC, medication. Question 36. The doctor orders Zofran 8 mg POTID. The pharmacy sends a 100 ml bottle, labeled 4 mg per teaspoon. How many ml should be given for each dose? D. 10 milliliters. 1 teaspoon equals 5 milliliters and 4 milligrams, multiply 4 milligrams times 2 to reach the ordered dose of 8 milligrams. It will take 10 milliliters, 2 teaspoons, to give 8 milligrams of Zofran. Question 37. At 6 a.m., the healthcare provider administers NPH insulin to a patient with diabetes. How soon may the patient show any signs of hypoglycemia? D. 10 a.m. NPH insulin is an intermediate-acting insulin, usually given once or twice a day. The peak effect of NPH insulin occurs 4 to 12 hours after administration, so the nurse should start to monitor for signs of hypoglycemia at 10 a.m. Hypoglycemia, blood glucose below 70 mg per dl, can have a rapid onset. Signs include shakiness, dizziness, anxiety, confusion, sweating, chills, and clammy skin. The patient's pulse may increase. The patient may complain of blurred vision, headache, fatigue, hunger, or nausea. Question 38. Before administering penicillin IM to a client with NKDA on his medical record, the nurse asks the client if he has any drug allergies. The client responds, "I'm not sure. I may have had a rash one time after I had a shot when I was sick." Which is the appropriate action for the nurse? D. Hold the penicillin and contact the prescribing provider. The nurse should hold the penicillin and contact the provider who ordered the medication. Even a mild reaction in the past puts the client at risk for an anaphylactic reaction, which typically occurs within an hour of administration. Common adverse effects of penicillin include rash, hives, itching, and swelling of the face, lips, and tongue. Question 39. Before a patient can receive a transfusion of whole blood, the laboratory and blood bank require a sample of the patient's blood. Which tests will be run? D. Blood type and cross-match. A blood type and cross-match is necessary to ensure a match between the blood donor and the patient who is receiving the blood. An incompatible match could result in severe adverse events and possible death. CBC, differential, culture, and sensitivity are unnecessary. Blood type and antigen screen is incorrect. The proper test is blood type and antibody screen, which will be performed as part of the cross-match. Question 40. The nurse hangs an 4 piggyback, IVPB, of vancomycin for a client who had a total knee replacement. When the nurse returns a few minutes later, which of the following indicates that the client is experiencing a serious reaction to the vancomycin? D. Rash on the face and neck. Vancomycin flushing syndrome, VFS, previously called red man syndrome, RMS, is a common allergic reaction to vancomycin that typically presents with a rash on the face, neck, and upper torso after intravenous administration of vancomycin. VFS is related to a rapid rate of infusion. It should not be administered faster than 1 gram/hour. Other symptoms are hypertension, itching, nausea, vomiting, fever, chills, weakness, dizziness, and tachycardia. VFS most often begins 4 to 10 minutes after the start of the first dose of vancomycin, although it can occur with doses as late as 7 days later. The nurse should immediately stop the infusion and notify the HCP. Treatment is with steroids and antihistamines. Future doses are given at slower rates. Sudden shortness of breath is indicative of anaphylaxis. Cyanosis is not related to VFS. Question 41. The pediatrician prescribes amoxicillin suspension 200 mg POQ 8 hours for a 3-year-old client with acute otitis media. The child weighs 38 pounds, 17.2 kilograms. The recommended daily dose range for children up to 40 kilograms is 20 to 40 mg/kg day in divided doses every 8 hours. Following the 10 rights of medication administration, what is the nurse's best action? D. Administer the medication as prescribed. The nurse should administer the dose, since it is within appropriate guidelines. The child may safely receive 344 to 688 mg day, in divided doses of 115 to 230 mg each. Amoxicillin, 20-40 kg day, is the antibiotic of choice for treating acute otitis media in clients older than 2 years who are not allergic to penicillin. Approximately 80% of children will have at least one episode of acute otitis media. The 10 rights of medication administration that are applicable here: right patient, right medication, right dose, right route, right time, and right assessment. Question 42. A client with a history of ulcers is starting on propantholine. When the nurse provides instructions with the client, which instruction is correct? D. Maintain good oral hygiene. One of the most common side effects of propantholine is a dry mouth, so good oral hygiene is important. Because propantholine reduces stomach acid, it has a drying effect that can also result in constipation and urinary retention. The client should be instructed to report side effects. Fluids are not restricted and there is no special diet. Laxatives may be appropriate. Question 43. A 12-year-old male is admitted to the hospital several days after stepping on a sharp object that punctured his shoe and penetrated the bottom of his foot. Concerned about possible osteomyelitis, the doctor has ordered parenteral antibiotics. Which of the following is done immediately before the antibiotic is started? D. A blood culture test is drawn. Antibiotics must not be started until a blood culture test is drawn, because administering antibiotics may interfere with identifying the bacteria and the appropriate therapy. The blood count will reveal the presence of infection but will not help identify the causative organism or guide antibiotic treatment. Parental presence is important for the adjustment of the child but not for the administration of medication. Question 44. A patient receiving vancomycin has an order for a trough level to be drawn. When should the lab collect the blood sample? D. 30 minutes before the infusion. A trough level should be drawn 30 minutes before the 3rd or 4th dose. The other answers are incorrect times to draw blood levels. Vancomycin is indicated for serious gram-positive bacterial infections, so it is important to monitor dosage levels. The typical trough level range for vancomycin is 10 to 20 gml. The reference range for peak levels is 25 to 50 gml. Question 45. During an angiogram, the patient suddenly says, "I'm feeling really hot." Which is the best response? D. That feeling of warmth is normal when the dye is injected. It will last up to 20 seconds. Patients should be instructed that it is normal to experience a warm sensation when 4-contrast is injected. The feeling lasts 5 to 20 seconds. Question 46. A healthcare provider is performing an assessment of a patient who is taking propranolol, Indrel, for supraventricular tachycardia. Which assessment finding is an indication that the patient is experiencing an adverse effect of this drug? D. Bradycardia. Beta-1 receptors are found in the cardiac conduction system and myocytes. Beta-1 blockade will slow discharge from the SA node and decrease speed through the AV node, slowing the heart rate. Propranolol, Indral decreases the strength of heart contractions as well as the heart rate, resulting in less cardiac oxygen consumption. Question 47. During a routine visit to the clinic, a client tells the nurse that they feel lightheaded after taking nifedipine for hypertension. Which question is most important for the nurse to ask the client? D. When do you take this medication? The nurse should ask the client when they take the medication. Nifedipine, Procardia, Adalat, is a calcium channel blocker. One of the common side effects is lightheadedness or dizziness. Other side effects include headache, fatigue, and shortness of breath. Calcium channel blockers may be taken at any time during the day, as long as the schedule is consistent. Taking it in the evening may minimize side effects. Grapefruit and grapefruit juice should not be taken with calcium channel blockers, but this is not related to lightheadedness. Potassium intake does not cause lightheadedness. Naps or rest periods are not related to dizziness. Question 48. A client with a history of severe alcohol abuse is admitted to the medical unit for alcohol withdrawal and detoxification. The client admits to having a drink 2 hours before their admission. Which of the following medications will the healthcare provider, HCP, prescribe for this client? D. Diazepam. A hospital provides the safest for an anticipated severe alcohol withdrawal. All clients should be given thiamine 100 mg as soon as possible, and then daily during the withdrawal period. Benzodiazepines, such as diazepam, alprazolam, chlordiazepoxide, or lorazepam, are prescribed to minimize agitation and anxiety, as well as treat possible seizures. Naloxone hydrochloride is used to reverse the effects of an opioid overdose. Disulfiram is taken to support alcohol abuse treatment by producing an acute sensitivity to drinking alcohol. Haloperidol is an antipsychotic drug, prescribed for schizophrenia and other psychoses. Question 49. The healthcare provider, HCP, prescribes 250 mg per 5 ml amoxicillin POQ8H for 10 days for a child's ear infection. The child's parent asks the nurse how much amoxicillin to give the child in each dose. Which of the following is the equivalent of 5 ml? D. 1 teaspoon. 5 ml equals 1 teaspoon. The parent should give the child 1 teaspoon of amoxicillin every 8 hours. The parent should use a medication spoon or dropper to measure the dose, not a household spoon. The nurse should educate the parent about completing the prescription even if the child starts to feel better. 1 tablespoon equals 3 teaspoons, 15 milliliters, which would be a triple dose. Question 50. If a drug is 50% protein bound, it means that D. 50% of the drug is available. The percentage of the drug that is not protein-bound is the amount of the drug that is free to work as expected. In this case, 50% of the drug is unable to be effective because it is protein-bound. Protein binding has nothing to do with drug excretion, protein in the diet, or the destruction of protein.